New COVID vaccine milestone. Children as young as 6 months old are now eligible for shots. ABC senior national reporter, policy reporter Anne Flaherty and Chief Innovation Officer at Boston Children's Hospital, Dr. John Brownstein, joins us now for more. Dr. Brownstein, good to see you. So I guess I've got a question first about how parents should make this decision and how the Moderna and Pfizer vaccines differ.
Well, thanks, Terry, for having me. I think that clearly the evidence is really solid in the fact that kids 6 months and over should be getting this vaccine. It protects them against infection, severe consequences, death. So definitely, the objective is to get these kids vaccinated. And the question is between the two, which one to do. And in fact, really, the differences are really subtle. Let's just say that they're both safe and effective, and either is a good option. The Pfizer's 3 shots, 3 weeks apart for the first 2, and then a third shot 2 months later. Moderna's 2 shots. It's also a smaller dose. They're both smaller doses in the adult size. If you get into the weeds, you start looking at the numbers, there's some important nuances and differences. You might get that protection faster with Moderna, but overall the safety profile for both of these vaccines is super solid. So at this point, just take whatever is available, but the benefits far outweigh any risk. So between whichever one you can get it and get your kids protected.
Good to go on both Moderna and Pfizer. And the vaccines have shipped out to hospitals. So what should we expect with a rollout for all those parents who are going to follow Dr. Brownstein's doctor's advices across the country and get their little ones vaccinated?
Well, I think what parents need to know, Terry, is that, first of all, you might not have a choice. This will depend on what your state is doing and how they're rolling this out. They might only be sending this to pediatricians, for example, whereas other states might be sending it to both pediatricians and pharmacies. You can also look at community health clinics. So a lot of this will depend on the area and what your local leaders have decided to do. But what we do expect is that capacity is going to expand over the next few days. We're probably going to see this initial rush of parents who are very, very eager to get their kids vaccinated. These youngest kids vaccinated. And then I think after that, it's going to slow down. It's a conversation you have to have with your pediatrician about, which vaccine you're going to choose. For me, I think the most common sense is, how quickly do you want them to be vaccinated? Do you want the 2 shots or do you want the 3 shots? And with the 3 shots, are you more concerned about putting your child in front of a needle 3 times? Or are you most concerned about the side effects and having that smaller dose? So I think parents will probably take that into account, but at the end of the day, they might not have a choice.
And Dr. Brownstein, I want to go back to this parental decision-making. The discussion that's out there. Children, thank God, in this pandemic, this particular disease has struck them less severely, mostly. They've been less susceptible to contracting COVID and to getting very sick with it. So how crucial is it, would you say, to parents who see that data and kind of wonder, is it for kids in this age group to get the vaccine?
Well, Terry, yes, of course we know that this virus is less severe in kids, but it has had still an incredible toll. We've seen millions of cases in our pediatric populations, thousands of hospitalizations, hundreds of deaths. And that's not, counting even long COVID or the MIS-C and other types of long COVID concerns that we should have. And we still don't even fully know the full range of impact of COVID in the long term in our kids, the cognitive decline, the physical impact. And so, yes, it is so critical to get our kids vaccinated, get that protection. And even if they've had previous infection, we recognize that many kids have had Omicron, but that isn't necessarily enough to give them protection against a wide range of variants that are out there. So yes, regardless of your prior infection status, it is so important to get those kids protected and really get them what we call foundational immunity, get them immunity, especially ahead of a potential fall surge.
Yeah, that's a great point, Doctor, that we still are learning about COVID. Its long-term effects, obviously, we don't know yet for those who have had it. And President Biden said that today is a day of relief and celebration for parents all over the country. But let's talk turkey. What is the uptake among parents around the country for the little ones in particular, the youngest age group, to get the vaccine?
Well, Terry, I think this is by far going to be the slowest uptake that we will see in this country with the vaccine rollout. As you mentioned, kids are less likely to get seriously ill. It is very rare, but pointing out that more than 400 children in this age group have died. And of course, this is out of 18 million children. That's what makes it rare. But if you're those families of the more than 400 children, this is very real for you. And this is an entirely preventable disease with this vaccine. So, I think we're going to see a slow uptake. But, come fall, fall, when parents bring in their kids for vaccinations or for their annual checkup, I think they're going to have that conversation with their doctor. I think things will change slowly over time.
You know, and I have to say, as somebody who was just out for a few days with COVID, I really couldn't believe how minimally it affected me. If it had been 3 years ago, frankly, I probably would have pushed through it and come to work. But these shots work, right? These vaccines work. We would have been terrified to get it 2 years ago, but now it's something you stay home for to protect others. And Dr. Brownstein, I want to ask about the children right at the top age of this age group. If a child's about to turn 5 and could get that dose for the older children, how would you advise parents on that?
No, Terry, this is a question I'm getting constantly. You know, I have a 4-year-old. Do I wait? I think you don't wait. You get the kid the vaccine now, get them protected, make sure that they're immune. And yes, you know, if they happen to turn 5 in the course of the vaccination schedule, the pediatrician may have them jump up to that larger dose. Remember, you know, it's not about the size of the child. So it's really about the age and the development of the immune system. So just because you may have a larger child at 4 years old doesn't mean that they need the adult version or the older kid version. But, you know, of course, you know, any vaccine right now will get them that protection. And we'll see, you know, in the fall about boosters and potentially other types of dosing recommendations. But clearly, if you're on the edge, you know, about to turn 5 in a number of days, you know, of course, talk to your pediatrician about a vaccination plan.
Absolutely. I want to pick up on that timeline with Anne. Boosters, this is a fact of life with COVID, obviously, and it looks like it will be for the foreseeable future. Do we know anything about timeline for boosters for children at this point?
Well, of course, the vaccine makers say that they want to come out with an Omicron-specific vaccine in time for this fall-winter crush. You know, we do expect that COVID will rise. The numbers will rise again in fall and winter. And that becomes a big problem, especially as people's immunity wanes. We know that the vaccine is protective. It keeps people out of the hospital. But we also know that immunity will wane with time. So they want to get people protected. Right now, the big question is whether or not the government's going to have enough money to cover the cost of these vaccines. Of course, you could still get it through your insurance program. But if you don't, or if you don't want to pay out of pocket, the government wants to make sure that people get vaccinated ahead of fall before things get bad.
That is good advice indeed. Anne Flaherty, Dr. John Brownstein, thanks very much, as always.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.